Hi everybody, Dr. Anjana Bana here and welcome back to my YouTube channel. And today we're going to be doing something a little different, but it is becoming more and more popular in aesthetic medicine and it's been around for a while. It's just in a different space. Traditionally, it is, I suppose, lip tattooing or a lip blush technique, but I get asked quite a bit about hyperpigmentation. We treat a lot of hyperpigmentation in the practice, and one of the things that bothers people is hyperpigmentation of the lip, especially in patients of color. So what happens with us is, as we get older, we've got these lovely even toned lips when we little kids, but as we get older, our top lip gets darker and darker, and it's complete mismatch to the bottom lip, and it really bugs patients. So patients don't want these like crazy pink lips, they just want even toned lips. And we do creams, we do peels, there's even laser treatments, but nothing really gets the color even and not to the patient's satisfaction. So there's something that I picked up. I actually saw it in a lot of Brazilian accounts because they do that quite a bit. There is something called lip neutralization. So using the concept like color theory, like warm colors neutralizing cool colors, to neutralize the lip first, and if you'd like a color, then later on adding. So Bev here, Bev is totally relaxed because this will be a second treatment. She's lying on the beach here. So we've already done one treatment for Bev more than 8 weeks ago. So usually it's spaced 8 weeks apart, and Bev's bottom lip was very pink, and we're getting top lip to even out as well. And there's two different colors that we use. It's like a pink and an orange. So those are really warm colors to neutralize the dark undertone or the purple undertone in anyone's lips. So it looks really crazy when it's done. It's very swollen. You can tell us, Babe, what it looked like the first day actually.
Yeah, it looks very swollen, and it looks orange.
Yeah, it's orange. So if you're doing a procedure like this, just make sure you plan correctly, that you don't have any big events that day or the next day. But with mask wearing now, we actually do have a couple of people that come for it and then literally go for an event straight after. We actually had someone who went to like a mother-daughter thing straight after, but she just wore a mask afterwards. So a lot of swelling after. And then there's quite a bit of post-treatment, keeping it moisturized, keeping it clean, because it can peel. So it's needling in the pigment. So it's also a bit of lip rejuvenation. The lip also gets a really nice shape and a bit of plumping. So we're going to start in a little while and show you the procedure a little bit, and then I'll pop in your before and after as well. So let's get going. So these are the two colors that we are going to use. So they seem super bright, but as you can see, even though Bev's had this procedure more than 8 weeks ago, her lips don't look super orange like this, or do not look super red like this. So this is called Kiss Me Softly, and this is called 1001 Nights. I have no idea how they come up with these names, but they're both warm, sort of orangey colors. And not everyone gets a mix like this. It's because Bev did already have a very pink lower lip. That's why we put in a little bit of extra pink for her. But if your lips are really dark, we often do 1 to 3 treatments of this, spaced 3 weeks apart first, and then if you want a bit of pink later on, we can. So we continually disinfect. So Bev's had numbing cream on her lips for some time. You can also mark the area. I can, if I really want, to give a dental block, but that also distorts the lip shape, the lip movement. So it might distort the final result. So now, because Bev has already had the procedure done, this may look not as orange as the first time, but this is the technique. It's basically like a perpendicular back and forth tattooing the color into the lip. You okay there, Bev?
100%.
Right at the end, we can wipe all the pigment that has settled around the lip off. But yeah, just make sure you're covered, your patient is covered. Also, the thing is, with patients of color, we are more prone to PIH, post-inflammatory hyperpigmentation. So when doing the lip, it's important to go gentle, set the pen well, it's set at 5.4, so not like an intense rate. And also the stretch on the lip has to be gentle, not like a intense stretch where the needle gets too deep. How are you feeling, babe? Any discomfort?
Nothing. Nothing at all.
So you can see there's like a little bit of pigmentation already implanted there, and then you go over at least twice. So this is a bit of a slow game, but also we want to be safe, and then we don't want to scar the lip. So it's better to do multiple sessions versus one intense session. So Bear's smiling, so it's fine. We've made it to the end of our treatment. We're popping on some post-treatment cream. It's a specialist post-treatment tattoo cream, and then she's also going to get some stuff to use at home. So it's important that she keeps her lips moisturized. It'll feel super dry tomorrow. It may even peel. I think the first time it did peel, hey Bear?
Yes.
And this crazy swelling will settle down by tomorrow. If because it's not something that the main aim is rejuvenation. So I might prescribe some cortisone if patients are a bit disturbed by it. A very clean ice pack. So make sure the ice pack is sanitized, because there's lots and lots of microchannels created here. And yeah, there we go, Bev. So that's the lip. So this is often what you see on those before and after Russian lip filler techniques. But this is not our aim. Our aim here is the color neutralization and equalizing the color of the lip. Are you feeling all right, Bev?
Yes, I'm fine.
Bev actually signed herself up for some more torture, but that'll be in another video. We're going to do some hand filler for Bev. She's had some hand filler before, but unfortunately we couldn't show that video, so we're going to redo a hand filler. But that's also another important point in terms of treatments and this treatment. So sometimes, it's not a once off. So like with the hand filler, you can always get a better result, or we might need to do a little bit more. And like with this, you'd expect to do, between 1 and 4 treatments to get your desired result, as well as maintenance a few years down the line. But thanks, guys, for joining me on this treatment video. This is something new, lip neutralization. If you have any questions, please drop them in the little question thingies below, the comments or whatever they're called, and like, share, and subscribe. Thank you.